For my project, I researched the different types of strokes and the rehabilitation needed for a patient to get better. A stroke, which is also known as a cerebrovascular accident, or CVA, is a sudden interruption in the blood supply of the brain. Strokes happen in two main ways. Either blood flow to the brain is blocked by something like a clot or something causes the bleeding like trauma. Without blood, the brain cells start to die, and that can cause serious symptoms, lasting disability, and even death. There are different types of strokes, starting off with the transient ischemic attack, also known as a TIA, which is a warning or a mini stroke. These happen when something temporarily blocks the blood flow to the brain, and symptoms only last for 15 minutes. There is also an ischemic stroke, which is caused by a blood clot in the brain, which can be embolic or thrombotic. An embolic clot is when the clot moved from a different part of the body to the brain, and a thrombotic clot is when the clot forms in one of the brain's blood vessels. Unlike the TIA, the stroke won't go away without treatment. And finally, a hemorrhagic stroke, which makes up 13% of strokes, is caused when an artery in the brain breaks open or leaks blood, which creates excess pressure in the skull and swells the brain, damaging the cells and tissues. There are two types of hemorrhagic strokes: an intracerebral stroke, which is the most common type and happens when the tissues surrounding the brain fill with blood after an artery bursts, and a subcranoid stroke, which isn't as common and causes bleeding in the area between the brain and the tissues that cover it. Strokes are the leading cause of long-term disability in the United States. 10% of survivors make an almost complete recovery, and another 25% recover with only minor impairments. For the best recovery, rehab should start at the hospital. It focuses on four main areas: speech therapy, cognitive therapy, physical therapy, and relearning sensory skills. For speech therapy, a speech and language therapist will work with patients to help relearn how to speak or find new ways of communication. Some speech therapy exercises include breathing exercises, tongue strengthening, practicing speech sounds, and naming pictures. Some at-home breathing exercises will require you to lie flat on your back and place a book on top of your stomach or lay your hands there. Take a deep breath in through your mouth and feel the book rise, then slowly let the air out through your mouth and feel the book lower. Your breaths should be easy and without effort. Then sit up straight in a chair, take a breath in through your nose, then slowly release the air through your nose and begin to make a humming sound. Feel the vibration in and around your nose and be sure that the sound is coming from your nose and not your throat. And finally, sit up in a chair with your shoulders back, breathe in through your mouth, and slowly release the air through your mouth while saying the word up, so it will sound like you are saying hup. For cognitive therapy, an occupational therapist can help the patient regain patterns of thinking and behavior. Cognitive therapy can include many fun things and games like Scrabble, Uno, Jenga, knitting, and painting. Games like Uno, Jenga, and Scrabble help with decision-making, attention, visual discrimination, and physical coordination. Knitting mainly helps patients that are limited to one functioning hand regain control of both hands. And painting uses motor skills, which helps people practice their grip while also letting them use different colors and textures. After getting a stroke, the senses can be dulled or no longer work as good as before, which means that they don't feel things like temperature, pressure, or pain. When relearning sensory skills, a therapist can help the patient adjust with exercises like hiding objects like marbles or coins in a bowl of rice or sand, then having the patient close their eyes and look for the items. Touch the patient on one spot with their eyes open, then with their eyes closed, and have them try to associate where they saw you touch their skin to how it felt. Then place different objects in your patient's hand while they're looking, and have them close their eyes and try to identify the objects as they are placed in their hand, again, one at a time. Move your patient's hand on paper while holding a pencil and have them try to identify what letter, number, or drawing is made. And finally, apply cold and/or warmth to the patient's skin and see if they can detect temperature differences. For physical therapy, a physical therapist will work with the patient to regain strength, balance, and find ways to adjust to any limitations. Some at-home exercises include knee extensions, seated marching, knee to chest, toe taps, and wrist curls. In conclusion, the recovery after a stroke is not easy, but all these exercises can and will help the patient have an easier and better recovery. All exercises can be done at home and however many times the patient can do. I hope you enjoyed and thank you for your time.